For many years, we were taught that an aspirin a day keeps the heart attacks away. I was never very impressed by that advice because the science behind it was scant. So I couldn't bring myself to advise patients to do it. It's one of the many traditions in medicine that get started because a few experts believe it and promote it to the rest of us as if it was revealed from some higher source. Nobody questions it because the experts told us it is so. Now we have the evidence to lay this one to rest. On March 17th of 2019, the American College of Cardiology and American Heart Association jointly published their latest guideline on preventing heart disease. On page 45 of this 98-page document, we see their recommendations for aspirin say that low-dose aspirin, like baby aspirin, might be considered for the primary prevention of heart disease among select adults 40 to 70 years of age who are at higher risk of heart disease but not at increasing bleeding risk. They do not recommend it for adults over 70 or anyone who is at increased risk of bleeding, such as those who are already taking NSAIDs like ibuprofen, for example, naproxen, Aleve, those with history of ulcers, and so forth. The committee notes that aspirin reduces risk of blood clots, but also increases risk of bleeding. Well, of course. They also note that those who have already had heart disease have been proven to benefit from aspirin. But in preventing heart disease, aspirin is more controversial. Well, let's look at the first source they rely upon for this recommendation. This is a systematic review for the U.S. Preventive Services Task Force on the role of aspirin in preventing heart disease, published in 2016. So let's take a look at that. Here is the review published in the Annals of Internal Medicine. Analyzing 2 good quality and 9 fair quality studies, aspirin was found to reduce the risk of heart attacks, the kind that don't kill you, by 22%. But they did nothing for stroke, and they had little or no benefit for death from heart attack or any cause for that matter. So here you have it. Meta-analysis showed a statistically significant 22% reduction in heart attacks that don't kill you. So, sounds like a decent number. Let's see what that really means. In Table 2 of this report, we see the results of taking aspirin for all causes of death and heart attack deaths. And noticing over here, when you have a negative number and a positive number in the confidence interval, that means there was 0 benefit. So aspirin did nothing to reduce death from any cause or from heart disease. Now we see some benefit in terms of reduction in strokes and reduction in heart attacks that don't kill people. Let's see exactly what that benefit is. So let's talk about heart attacks. Suppose you're at low risk of heart attack to begin with, meaning you don't smoke, you're not obese, you don't have diabetes or high blood pressure or bad cholesterol. Then your risk of having a heart attack is 0.90, in other words, less than 1 person per 1,000 person years. Now, if you take that aspirin, that's reduced by 0.15 persons. It goes from 0.9, less than 1 person, to 0.75 of a person. And let's see what that means in a simpler way. Taking a look at our handy clinical calculator, we click on patient years and we enter 0.9 events at baseline, and then taking aspirin, the experimental group drops the events down to 0.75, and that's per 1,000 patient years. We hit calculate, and looky there, we've just discovered 6,666 people would have to receive the experimental treatment, aspirin, for 1 person not to have a heart attack. How do you like them apples? Nearly 7,000 people in the low-risk group. Now let's see what that goes to in the high-risk group. We're starting out with 8.44 in the regular group, and we drop it by 1.43. So we enter 8.44 in our control group and subtract 1.43, so that becomes 7.01 if my math is good. Events per 1,000 patient years, let's calculate. So in the high-risk group, those who have those diseases I talked about, such as diabetes, obesity, high blood pressure, and so forth, 705 people have to take aspirin in order to prevent one heart attack. Now, I don't know about you, but that doesn't seem like a whopping benefit. I guess if you were the one person who didn't have a heart attack, then you'd be happy. But what about the other 704? That's a lot of people taking a drug that increases your risk of bleeding who get zero benefit out of it. Now, of course, as your doctor, I don't make the decisions for you. You have to make the decisions for yourself. If it's worth it to you, take the aspirin. The appeal of such a simplistic solution as taking a tiny pill every day is easy to understand. It's cheap, easy to do, saves lives, and has no risk, right? As we now see, this recommendation was decades premature. If you are concerned about heart disease or stroke, your best bet is to come in and have a full, personalized cardiometabolic evaluation. When it comes to your health, there is just no such thing as one size fits all. I'm Dr. Ray Andrew, and this has been the Medical Minute. Thanks for watching.